Please welcome Mike Long, CEO of Lumeris, and Jane Saracen-Kahn.
Good morning, everyone. Hey, it works. All right.
Whoa.
So to kick off this conversation with this fascinating guy, Mike Long, I love you all this much that I hand-carried my first edition copy of The New Thing all the way from Philadelphia on the plane. Hard copy, not Kindle edition. And I'm going to read from chapter 11, the chapter called How Chickens Become Pork, about this guy and make him blush. This chapter talks about how Jim Clark, founder of Healthion, was looking for a CEO and talked to John Doerr, who's down the street from here in Silicon Valley, to find a CEO. So John Doerr goes to Phoenix and he finds this guy called Mike Long. And in this chapter it says, everything about Mike Long was reassuring to Jim Clark. His gentle manner. Little did he know. His prematurely gray hair, his ability to appear in complete control. When Mike Long entered a room, everyone in it somehow felt better. He attracted followers as a magnet attracts filings. In other words, he was exactly the right man to take an inherently implausible idea and lead others to believe in it. So that's when Jim Clark drew on a napkin something that in legend was called the magic diamond, with providers and payers and doctors and health plans, where Healthion would sit in the middle and be something like an HIE, I guess. Talk to us, Mike Long, about what's different from this 16-year-ago book and today. What's changed?
A lot's changed, thank goodness. So, it was a fascinating adventure, building Healthion WebMD. Some really interesting companies came out of it. WebMD, which became the largest health information and community site in the world. MDON
Yes.
became a dominant player in the EDI transactional space, and a lot of private companies spun out of that. But our mission was to bend the cost curve of healthcare because we're trying to defeat the rule of 72. How many people know what the rule of 72 is? All right, not many. Well, in finance, you learn that if you want to understand the rate at which money doubles, there's a simple formula. It's the compounding rate times the number of years, always equals 72. And so you can solve for one or the other. And in healthcare, it's been doubling every 10 and a half years. So that's the problem we were trying to solve. And it was 1.2 trillion then, and it's 2.6 now, so we failed big time, according to my partner, John Doerr, biggest failure in business history, based on that measure. So now a lot of things have changed. Some issues we ran into, it really was not about technology or an absence of technology. Maybe we overestimated the rate at which the industry would see the opportunity that the internet presented itself around data transparency. But what's changed 12 years later is we have ubiquitous connectivity. Healthcare is finally getting rid of the paper files, because it's really tough for the internet to reach into those paper files in doctors' offices and hospitals and liberate the data. We now have a big conversation about behavioral economics. Yeah. In other words, paying doctors and providers to deliver higher quality health care at a lower cost. We didn't talk about that 10 years ago. We were afraid the malpractice lawyers in the room would say, I knew it, they were doing it for the money. Now we openly talk about behavioral economics. Healthcare services are disaggregating. Because the market forces, basically, with transparent information and greater collaboration, lowest cost, highest quality, most timely provider of a service should get the business.
Sure.
And finally, the country's broke, and healthcare contributed to it. So we have no choice. Yeah. It's wonderful. We finally put ourselves in a box where we have to transform.
That's great. That's great.
Yep.
So now you're CEO of something called Essence Healthcare.
Yep.
Tell everybody what Essence is trying to do.
Well, we're an odd duck company. We're a non-traditional approach to this. One of the learnings from Healthion WebMD is that healthcare is hyper-local. We also learned the importance of population health management. And so to build a technology company, we actually went out and went at risk for a population of about 40,000 seniors. And we organized that population about 5 years ago and went at financial risk in collaboration with providers. And then we started investing capital and technology, trying to figure out how do you actually lower cost at the population level, how do you improve quality, the triple aim, how do you improve the patient experience. We also added triple aim plus one. How do you improve physician satisfaction? Because we think physicians are pissed off in this country, are upset in this country right now.
No, we speak English here. They are pissed off.
Okay. So we established those 4 goals, and it creates a different mindset when you get out of bed every morning and you're responsible for the health care of 40,000 people, financially and the quality of their lives. And then we invested all this technology in building it, and then last year we launched our technology company called Lumeris because we thought others might be interested in what we learned and the capabilities we built.
So where do you foresee taking Lumeris now?
Well, some of the earlier speakers said, we're not trying to boil the ocean. Well, maybe we are. We're flooding. We're going to flood the market with, I'll use that word, solutions rather than products. There's a lot of point solutions sold in healthcare, and it really forces these big hospital systems and payers to be great systems integrators, and they're not. So they need comprehensive solutions around population health management and accountable care. And so we're providing what we think is, we call it a white cloud architecture that's got a lot of cool apps in it. We aggregate the data, and we pull it from really clunky systems. We had to be world class. And for all you there's a lot of young entrepreneurs in here that are working with the latest and greatest technologies. Well, one of the things you're learning about healthcare is that every software system that's ever been installed in healthcare is still operational. Written in languages like COBOL and MUMPS. We're still installing systems written in MUMPS today in healthcare. And you got to go liberate that data. You got to figure out how to get that data out. You need to, then once you've got that data aggregated, you've got to distill it to find out what's really important. And then you've got to amplify it. You've got to add intelligence to it. Like, what does it mean? And then you've got to deliver it to the decision makers if you're going to improve outcomes, both on the clinical and the financial side. It's a very exciting time.
It really is. You raised this great point where all this technology still exists, and you add a piece of technology in healthcare, it's additive, not substituting. And we've seen that that fax machines are still the major networking technology in most hospitals, which is amazing to me.
No, if you got a business model based on replacing technologies, and that's going to be the savings you're going to deliver, good luck.
In healthcare especially.
Yeah.
So this brings to my mind that you've been watching and working in this field for a very long time, as I have. But I cover my hair now. We talked before this conversation about the role of missionaries versus mercenaries in healthcare. And I think you've got an important message to share with everybody as sort of a wise guy in this area. Could you talk about missionaries and mercenaries in healthcare?
Well, there's two philosophies to build a great company. And it's the missionary approach and the mercenary approach. And it's not a value judgment, it's just a different approach. You kind of have to decide which you are. A mercenary says, I want to make a lot of money. What problem do I need to solve to make a lot of money? A missionary says, I want to solve a really big, important problem, and if I do, I probably will make money. That's the wonderful thing about the United States, is it rewards people that solve big problems. So we're very much, my partners are in the missionary category, because then this is a long haul, it's not going to happen overnight. We need help. All you entrepreneurs out there that are building cool apps, in healthcare, Mike Long at Lumeris.com, M-Long at Lumeris.com. Send me an email. I'd like to hear from you, because we need to form a coalition, because there's a lot of big established companies out there who could help solve the problem that are moving way too slowly. So I need your help.
And we've talked, in the green room, as it were, we were talking about some of those big established companies and how hard it is to knock them off of this idea of what's the next billion-dollar idea, right? You got to build it slowly. So as we talked about, as I alluded to earlier, the magic diamond of Healthion with payers, providers, doctors, and consumers. The reason that vision couldn't come to play were all these barriers, these institutional barriers, whether it was the doctors within the doctor community and across these other silos. How will Essence break down those barriers? Okay.
The solution, I use that word. What's wrong with the word solution?
I won't beat you up like Neil would.
I don't know what's wrong with that word. Solution means solving a problem. And we got to transform the business models and the incentives in healthcare. So technology is insufficient. It's wonderful, but insufficient. So I call it the tools. You got to get the tools right, and we can build the tools. You guys are out there in the audience. You're building a lot of cool tools. We are as well. But then you've got to get the information, and getting the information in healthcare is really hard. We found out with Healthy on WebMD that the only real large-scale digital information 12 years ago was the big payers had claims databases, and they were paranoid that if they dispersed that data, that they might get disintermediated, even though that proved not to be true. So without the data, the vision was diminished substantially. And finally, incentives. And you got to get the incentives right. So all you guys that are focused on consumer apps, look at, are the consumer incentives there to actually use your apps? And if the behavioral economics isn't there, it doesn't matter how cool your technology is. Same applies to doctors. So tools, information, and incentives. And now we've got the opportunity. That was not aligned 12 years ago. And now it is. And government regulation, for the first time in my life, which is a long life, I'm really old compared to most of the people in here. I was alive in 1964. Title 18 of the Social Security Act was passed. It created this problem. This problem was created 40 years ago when we basically took away accountability from consumers for paying for their health care. And then we shifted it to the government and to employers and the private sector, away from consumer accountability. And then we said, doctors, you aren't responsible for what things cost either. And then we wonder why the system got screwed up. It's the only industry in the world where the people who deliver the service are not responsible for the cost of the service. And that's changing now. That's what accountable care is. It's a very exciting time.
Yeah. So we have time for one more big question. So the big question is...
Let's take another hour.
Another hour.
There's so much to talk about. Yeah.
Will Essence and Lumeris be the new thing?
Oh, really not interested in any more publicity. You know, I don't want any more books written. And we're trying to solve a big problem. And I think we need to spread the credit around. This is not about me. It's really not about Essence Lumeris. It's not about John Doerr and the wonderful missionary investors that we have. They entrusted with Healthy on WebMD. We raised $2 billion in that initiative. It was a serious effort.
Real money.
And investors did okay. Don't worry about the investors. They did fine. We didn't solve the problem. This time around, we're going to solve it. Need your help. And it's just a collaborative effort. And I think if the great technologists in this country collaborated together and we would reassure the providers and the payers that this is a solvable problem, that managing both financial and clinical risk together is not a dream, it's actually a reality.
Yeah, that's great. As we heard yesterday throughout the day, the issue of the health ecosystem and co-opetition working together across silos was really how we were going to solve the problem, and that's exactly the message that you brought today. So thank you so much.
You're great, Jane. Thank you. Thanks for
Thank
inviting
you.
me.
My
Good
pleasure.
luck to everybody. Great.